1. In adult learning theory, which instructional strategy best supports certified coding specialist CCS candidates in mastering ICD-10 CM coding guidelines? A. Memorization through repetition. B. Case-based coding exercises using real-world patient records. C. Lengthy lectures covering each guideline in sequence. Providing a glossary of coding terms without context. 2. When evaluating CCS candidates' understanding of sequencing guidelines, which method provides the most valid measure of competency? A. Oral recitation of rules. B. Multiple choice exam with distractors. C. Performance-based coding scenarios with chart review. D. Peer discussion without scoring. 3. During CCS curriculum design, which principle ensures alignment with regulatory requirements? A. Random inclusion of coding examples. B. Mapping learning objectives directly to AHIMA CCS exam domains. C. Following generic curriculum design principles without context. D. Using only CPT examples to represent all coding systems. 4. What is the primary benefit of integrating formative assessments into a CCS training program? A. To increase the final exam difficulty. B. To provide ongoing feedback that shapes learning progress. C. To replace summative evaluation entirely. D. To meet a minimum requirement for accreditation. 5. A CCS instructor wants to address adult learners' preference for autonomy. Which approach is most effective? A. Assigning coding practice without explanation. B. Allowing learners to choose case studies aligned with their workplace setting. C. Limiting resources to one coding manual. D. Requiring silent memorization of guideline tables. 6. When mentoring new CCS candidates, the supervisor emphasizes the importance of coding compliance. This best reflects encouraging creativity in coding choices. B. Aligning instruction with legal and regulatory standards. C. Minimizing the role of official coding guidelines. D. Prioritizing speed over accuracy. 7. What is the most effective way to evaluate CCS candidate skills in handling complex outpatient coding cases? A. True-false tests. B. Coding simulation exercises with complete medical records. C. Short answer definition tests. D. Peer role-playing exercises. 8. Which communication strategy should a CCS mentor use when providing corrective feedback to adult learners? A. Deliver feedback publicly to maximize accountability. B. Provide immediate, constructive, and specific feedback privately. C. Delay feedback until the final assessment is graded. D. Use generic phrases like, try harder next time. 9. In curriculum development for CCS preparation, which method ensures integration of compliance topics? A. Embedding HIPAA, OIG, and CMS regulations within coding case studies. B. Relying only on external compliance seminars. C. Teaching compliance separately without application. D. Minimizing compliance to save instructional time. 10. What principle of andragogy is most critical in CCS instruction? A. Adults are dependent learners who require strict control. B. Adults bring prior healthcare experience that enriches learning. C. Adults prefer learning with minimal application. D. Adults avoid problem-solving tasks. 11. When evaluating CCS candidates' abstracting ability, which assessment is most valid? A. Asking them to explain the definition of abstracting. B. Having them abstract data from sample operative reports. C. Reviewing their ability to recall DRG definitions. D. Checking if they memorize coding guidelines. 12. A CCS educator must ensure test reliability. Which action best supports this? A. Randomizing unrelated questions. B. Using standardized patient records across all exams. C. Allowing students to write their own exam. D. Including only one question per domain. 13. Which mentoring technique best prepares CCS candidates for certification success? A. Providing unstructured discussions without objectives. B. Modeling accurate coding practices with guided practice. C. Reducing feedback to encourage independence. D. Assigning cases without review. 14. How should a CCS trainer evaluate learners' ability to apply CPT modifiers? A. By asking them to list all modifiers. B. Through coding exercises requiring modifier selection in complex procedures. C. By providing a written definition of each modifier. D. By using flashcards. 15. What role does regulatory compliance play in CCS exam preparation? A. It is optional and not tested. B. It forms a core component of both instruction and assessment. C. It only applies after certification. D. It focuses solely on HIPAA, excluding coding guidelines. 16. Which instructional strategy helps adult CCS candidates manage coding updates effectively? Ignoring changes until exams are complete. B. Embedding annual updates into case-based learning. C. Teaching only outdated guidelines for stability. D. Avoiding exposure to complex updates. 17. When designing summative evaluations for CCS candidates, which approach ensures fairness? A. Tailoring questions based on individual learner preferences. B. Using standardized, validated test items across learners. C. Providing open book tests only. D. Reducing test length to minimize stress. 18. What is the most effective mentoring approach for addressing coding errors in CCS practice? A. Ignoring minor errors to build confidence. B. Providing corrective feedback with rationale and references. C. Reprimanding publicly to ensure accountability. Giving feedback only at the program's conclusion. 19. Which adult learning principle is applied when CCS candidates learn better by working with real EHR extracts? A. Passive absorption. B. Experiential learning. C. Memorization-based learning. D. Lecture-based teaching. 20. A CCS trainer notices candidates struggle with evaluation and management (EM) coding. Which solution is most effective? A. Offer drill-based memorization of levels. B. Incorporate interactive case studies with step-by-step feedback. C. Provide only lecture slides for review. D. Skip the section due to complexity. 21. When mentoring a new CCS candidate on coding compliance, which strategy best supports adult learning principles? A. Providing lengthy lectures on all coding guidelines in one session. B. Encouraging self-directed case study reviews with guided feedback. C. Restricting access to resources until after certification. D. Emphasizing memorization drills without application practice. 22. What method best evaluates CCS candidates' ability to assign correct DRGs? A. Having them memorize DRG tables. B. Reviewing performance on inpatient coding case scenarios. C. Using matching questions about DRG definitions. D. Testing through oral recitation. 23. A CCS educator designing curriculum objectives must ensure they are A. Broad and non-specific. B. Measurable, observable, and aligned to competencies. C. Flexible with no link to exam content. D. Focused on personal interests of the trainer. 24. Which communication approach fosters collaboration among CCS learners? A. Encouraging peer review of coding assignments with structured guidelines. B. Restricting discussion to individual work only. C. Discouraging questions during practice. D. Focusing only on instructor explanations. 25. Why is ethical decision-making critical for CCS candidates? A. It builds trust and ensures compliance in coding practices. B. It is optional for certified coders. C. It is unrelated to exam success. D. It applies only to billing specialists. 26. In mentoring CCS candidates, how should a mentor model professionalism? A. By demonstrating accuracy, compliance, and integrity in coding. B. By focusing solely on personal experiences. C. By encouraging shortcuts for faster results. D. By limiting learners' exposure to coding tools. 27. What evaluation method best identifies a CCS candidate's ability to abstract from pathology reports? A. Short answer questions about terminology. B. Coding exercises requiring full abstraction and code assignment. C. Peer group discussion without grading. D. Matching definitions. 28. Which adult learning principle is applied when CCS candidates are motivated by seeing the direct workplace application of coding knowledge? A. Self-directedness. B. Relevance and immediacy of learning. C. Dependence on authority. D. Memorization-only learning. 29. A CCS instructor wants to evaluate both speed and accuracy. Which method works best? A. Timed coding simulations using complete case records. B. Multiple choice knowledge quizzes only. C. Oral quizzes about guidelines. D. Open discussion of errors. 30. Which instructional resource most supports regulatory compliance in CCS preparation? A. Current ICD-10 CM, CPT, and HCPCS code sets with official guidelines. B. Old textbooks with outdated examples. C. Learner-created summaries only. D. Non-healthcare case studies. 31. A CCS mentor encourages learners to reflect on their errors and self-correct. This approach demonstrates A. Reflective practice and self-regulated learning. B. Strict instructor control over learning. C. A focus only on summative evaluation. D. Minimal learner responsibility. 32. When designing a CCS training module, which evaluation method ensures both knowledge and application are tested? A mix of case-based coding exams and knowledge checks. B. True-false quizzes only. C. Oral definitions without application. D. Group discussions with no scoring.